So, in this lecture, we are going to see the importance of ambulatory BP monitoring and its role in hypertension management. So, first to give you some introduction that we have an incidence of hypertension or prevalence of hypertension in India is around 30 or 33%, and that means 1 in 3 Indian suffers from hypertension. And hypertension produces more strokes than coronary heart disease. In India, as you know, the stroke is a more devastating disease for the person, for the patient as well as for the family. So in hypertension management, we must aim to prevent strokes. So unfortunately, you know, the status of the controlled blood pressure in India, worldwide, you can see, as well as the Indian side. So in the Indian side, you can see that only 7.5% or 7.8, or you can take it as 8%, had controlled blood pressure. This is as early as late as 2019. So 76.1% ever received BP measurement. 76% do not take the blood pressure. 44% are aware they have hypertension. Only 13% coming for treatment. In those who are coming to the treatment, only 8% have achieved the control in India. So this is Indian statistics. Whereas between states, the control among individual hypertension varies from 2.4% to 21% in Daman and Dayu. So the control among individuals can be as low as 2.4 to as high as 21%. At 38%, 28.8%, 28.4%, and 28% for post-patient, the 4 states, the Puducherry, Tamil Nadu, that is 28.8%, Sikkim and Haryana, had the highest proportion of all adults, irrespective of the hypertension status, in the sample age range who had hypertension but did not achieve control. So we are in the top 4 states which do not achieve significant control of blood pressure. So commonly we see a patient who has got a very good BP control in the clinic suddenly landing with a cerebrovascular accident. Some patients who have got a long-standing high blood pressure, but they do not develop anything at all. So this is a paradox we see in our day-to-day practice. How to explain these 2 scenarios?